Okay, I think we'll go ahead and get started on our next Ivan Roundtable workshop, Automated Structures Verification, Balancing Speed and Accuracy in NMR Analysis. This time I'm going to turn it over to David Rice to get us started.
So our leader today is Dimitrios Akriopoulos, and he has a group of 3 colleagues with him who will all talk about automated structure verification and determination with NMR. So without any further delay, let's hand things over to Dimitrios and get started with our presentations.
Thanks a lot, Dave. So yes, we will be discussing about automated structure verification today and balancing the speed and accuracy in NMR analysis. The main question that we have to answer as people working with NMR is, what's in my NMR cube? And the answer sometimes may not be that straightforward. So let's see what we have and what we can do. And ASV will help you if you have these conditions fulfilled. So if you have a good idea of what could be in your NMR cube. So probably you know the reaction and you know the possible products. Or you know most of the structure, but only missing a small part. Or you know that you have seen this structure before. And all of these in the end boil down to the fact that you can propose one structure or some structures. And that's how you take it. So you record your spectra, you have your proposed structure, and then the task is to see whether the spectra agree with the structure or whether the structure is correct for these spectra. And as I say, you can't really always, you can't, categorically conclude that the structure is correct. You can conclude that the structure is wrong. And in essence, you say that the structure is correct just because you can't prove it wrong. But anyway, you see what I mean. So this whole process is something that's that can be done either in a small scale, so just a chemist going and submitting a sample and recording it, or it can be done through bigger environments like open access labs or high throughput experimentation setups or anything like that. And in the end, you have to distinguish 3 possible options for automated structure verification. The first is single structure verification, single data set verification. So you have one data set and one structure, and you just do it semi-manually on the computer. You just click verify. Or you can have multiple structures, multiple data sets, offline verification. So you record several spectra. Maybe you do, a plate run overnight or over the weekend, then you come back and you process everything together. Or you can have the full thing, the automated, unattended, multiple structure, multiple data set verification. So you have something like an open access lab. Chemists come and submit their samples, define what experiments they want to record, and they want to have the answer as quickly as possible. And in that case, you are running
I'm just calling
system.
you back. I'm out of my meeting. You can call me anytime. Bye.
And you need to have the answer as quickly as possible. And because the chemist, is waiting for the results in order to continue. Now, how does the output from automated structure verification would look like? Well, you will have your spectrum, you will have your peaks, you have your proposed structure, and then you get a number, a match factor, 0.82. This means 82% the structure is correct. You can have a few more metrics available, but in the end, that's what you are looking for. And you are looking for large match factors that would indicate that the structure is mostly correct. Now, what is the threshold? This is something that, touches on the borders of religion. Some people will say anything about 75%. Other people will say anything above 80%. I've seen somebody who said anything above 95%. Well, whatever. Generally, 0.82 is considered a very good match factor, but we will hear more about this from our presenters, I believe. So the next question that people are asking is what spectra are required. to do automated structure verification. In reality, you can set it up with any type of spectra. There is no problem, setting it with just HSQCs or just proton. However, the more spectra types you have available, the more reliable the result is. And I'm focusing on the word reliable. Okay, you're not going to have a higher match factor if you have more spectra, but the match factor you will have is going to be more reliable because you will have more parameters that are included and more parameters that are taken into account. The aim in all these systems is to have a high pass rate, that is to have a high number of correct answers, and to avoid false positives. So you will have pass, you will have fail, you will have false positives and false negatives. It's the human nature that we look at the negatives to see why they failed. They wouldn't bother about the pass. So if you have a false positive, this is not good. And you need to somehow ensure that you have as little false positives as possible, ideally none. And then you start looking only at the fails and see why they failed and see if they genuinely failed, if the sample was bad, because it does happen, of course, or the system needs maybe some tuning or a bit more training. Of course, time considerations are important. We don't have infinite time. We could record all sorts of spectra, but we don't have time. Maybe there are other chemists waiting, and you may only have 1 or 2 spectrometers and like 200 chemists waiting. So that's not something that should be ignored. Even though we've seen that the ideal case is to have a 1D proton, 1D carbon, HSQC, and HMBC, unfortunately, I could probably count the people who are doing this in the fingers of one hand, and there will be quite a few fingers left, So the big problem is that, if you can do maybe a 1D proton in 5 minutes, including sample change, locking, simming, and everything. You have another 5 minutes for an HSQC, and then you have maybe 20 minutes for an HMBC, so you are at half an hour. So if you need half an hour per sample, then you can only do 48 samples per day. Well, if you have 100 chemists, that's a problem. Now, if you go to add a 1D carbon, which may take 1 hour, you can reduce the numbers even more. So we have to be a little bit pragmatic on what's happening. And I believe that our speakers will touch on this. And I just want to show you here the effect of adding more spectra. This is from a study done many, many years ago. So please ignore this vertical scale because it's maybe outdated by now or certainly very sample set specific. So in this sample set, we tried having just a proton spectrum, and we see we had a good pass rate, but a very high false positive. 40% false positive is not good. The moment we added HSQC, the false positives dropped quite spectacularly. And when we added another source of quaternary carbon information, either a 1D carbon or an HMBC, this dropped even more. So the important thing is to have information there that will show you what's happening in the skeleton, in the scaffold of your molecule. If you are only recording the protons, you are only looking at the periphery. You need to have information about the carbons and the quaternary carbons. If you have everything, it's even better. I mean, I can tell an example here. We had a case where somebody was using an ASV system to check their raw materials. And they had this polysubstituted aromatic ring, which only had 1 proton. So if you recorded only a proton spectrum, in essence, any sample with a single peak would have verified against that structure. So you need carbon information. That's the bottom line. The other question that we are being asked is, do we need mass spectrometry? Of course, we are doing NMR, so mass spectrometry, come on. But anyway, NMR and mass spectrometry verification are orthogonal techniques. And they will both give a pass or fail, looking at the problem from a completely different point of view. However, mass spectrometry runs are generally much faster. So you could have the mass spectrometry run maybe in 1 or 2 minutes, whereas NMR, as we said, will require longer. So it is very common that samples are initially screened by MS, and only the samples that pass are further analyzed with NMR. So probably, yes, you will need MS, but not online and processed at the same time with NMR, because it's not practical. Of course, yeah, if you have samples that failed with MS, you may still want to run NMR with them in order to see what happened. But at that point, you are not doing any more sample verification. You are doing rather structure elucidation, trying to see what you have in there. So that's what I wanted to present in order to start this meeting. And I'm going to hand it over to our presenters. We have 3 presenters today. The first one is Emin Sazer. I hope I pronounced it correctly, Emin. Emin studied at Paris Sud University, did her master's degree there, and then at the Karlsruhe Institute of Technology, where she did her PhD. She had been with Novartis in Basel for the past 21 years, and she had been in the NMR group during all that time. The second presenter is Kathleen Farley, who you probably are aware of. Kathleen studied at Illinois State University and then spent 36 years at Pfizer in various locations, various labs, but she had always been doing NMR. And for the past year and a half, she has been an NMR consulting specialist, and she's going to tell us today some things about her experiences with ASV. Finally, last but certainly not least, we have Richard Lewis from AstraZeneca. Richard studied in Cambridge in the United Kingdom, of course, and did his PhD in physical organic chemistry. Richard has been with AstraZeneca for 35 years. And that sounds impressive, but what's even more impressive is that he spent the first 20 years in Loughborough in the UK, and now he has been in Gothenburg in Sweden for the past 15 years. Still with AstraZeneca, still doing NMR. So without further ado, I think I can pass it over to the first presenter. Emin, are you there?
Good morning, US, and good afternoon, Europe. I will show you how we integrate automatic structure verification in our workflow in Novartis. So the title of my presentation is Lab 2 NMR, Dynamic Parameter Optimization and Automatic Structure Verification, ASV. For us, it's the ideal combination transforming chemics workflow. It was a vision that turning into reality. First, the agenda. Today, I will go through first for the overview of the NMR instrumentation that we have and the Lab 2 NMR installations. Then I will give you some the sample preparation and the monitoring tool that we have to optimize data quality. We will go through the different workflow that we have at Novartis. I will show you how we integrate ASV, and then the enhancement in NMR parameter adaptation and ASV performance, and give you some key achievements that we have with this workflow. First of all, the group at Novartis in Basel is composed from, we are 6. We are working in synthetic chemistry support, so the NMR workflow, instrument oversight, the experimentation optimization, ASV, analytical data management system at AMS and data access, the Lab 2 NMR, and structure validation report. We also have dedicated projects, so we have different projects in the group, some stereochemistry, QNMR, confirmation, 3D, RNA, peptide, and protein ligand interactions. For all this work, we have different spectrometer. Here you can see the map of the campus in Basel at Novartis. You can see we have different buildings. We have the chemistry building. The biggest one is this one, the 088, where we have the most of the spectrometer. We have in total 15 NMRs at this campus. 11 are for chemistry, 3 for structural biology, and 1 is its development. So in research, we have 13. For the chemistry part, we have 11, 9 on cryo system and 2 non-cryo. 7 of these spectrometers are in this building, the 088, and you can see the other one are distributed through the campus. Between this building 088 and 386, you have to walk 15 minutes, just to give you an idea how far it is. That's why we installed the lab-to-lab system. It's what you can see in pink, that we have the building-to-building system too. That means from this building at 10th floor, for the 8th floor, chemists can send a vial, and then it will arrive in the lab-to-lab system. I will explain you how it works. We decided to use a lab-to-lab system because chemists are in different buildings, and that will help the optimization, and we will win time in the tube preparation and to arrive in the NMR lab. Just to explain you the lab to NMR installation in Basel. So here in the map, I summarize how many chemists there is in each building approximately. This change every year with the intern, with people that leave, with people who come, but this approximately, you can see that the more of the chemists are in this building, the 88, the other one are in different buildings. In this building, for example, we have 12 chemists. They don't have any NMR spectrometer here, but it's bound to the lab-to-lab system, and they can send vial. How it works? On all floor where there is a chemist, there is this sender, this lab-to-lab sender. Chemists have to fill this vial with the 2D barcode on the bottom, and they fill it with the deuteric solvent, so they can use DMSO, water, or methanol, and then they send it via this sender. Then here it's difficult to see, but you have a tubing with an airflow, and this vial will arrive automatically here on this robot that's bound to the spectrometer, and then only the robot will work. It will transfer, so it will arrive here. This needle will come, take the solution. Here, this is empty tube. It will fill the empty tube, and the empty tube, then you have a second arm here. It's not very, it's black, so it's hard to see. Will arrive, take the filled tube and put it in Q. This is a Q rack. And this is, when the measurement is finished, this is the tube is transferred here. I will explain you then how we can find a tube again here. So here we have lab-to-lab and building-to-building system in order to win time and to have a better distribution of the measurement on the different spectrometer. Because here you can imagine you have a 400 megahertz spectrometer with a cryo, but only 25 chemists. So this will not be very used by only these 25 if we don't have the lab-to-lab system. Then the distribution is better with the lab-to-lab system. Here, I just summarize the different spectrometer that a chemist can use for open access measurement. This is not for the our support measurement. They have a 600K and the other one at 400 and one 500. All these 6 spectrometer here are cryo system. And they have 2 non-cryo, a 400 and a 600. Approximately all spectrometer can measure proton, carbon, fluorine, and phosphor. We only have this special 600. This is invert probe head where the carbon is more sensitive. And this 500 cannot measure phosphor. We have 5 systems in lab-to-lab, the PONLA, this 5 here. And all this one you can use only short 3 millimeter tubes. On the 600, this is a sample jet. They can use 3 and 5 millimeters. And on the non-cryo, this is a standard 5 millimeter long NMR tube. Here, you saw that we have a lot of spectrometer distributed on the campus and different buildings. This is in order to be able to follow and to have an idea what's happened on the different, we have different tools. We have this first on the middle, the dashboard. This is a tool that one of my colleagues created. We can see on our PC what's happened in live. That means you will see here the 5 lab-to-lab. We have here in green the Q day on all spectrometer, and in the bottom the night time. And we have the same thing for the non-lab-to-lab spectrometer. If it is green, that means it's less than 1 hour. If it is gray, it is between 1 and 2. And if it is more than 2 hours, it will be yellow. And if it is red, this gives us an idea that the spectrometer have a problem and need troubleshooting. That we don't have to check one by one all spectrometer what happened. This dashboard for us is very important. Then we also have this dashboard for the lab 2 NMR buffer. Here we can see the vial number of this small vial from the lab to lab, and we can see the waiting time in the buffer, because before it is distributed to a one lab to lab, it will wait in a buffer and it will see which spectrometer is available, and it will be sent to the spectrometer where you don't have a big queue. But it will wait first in a buffer. And this will give us an idea if we have a problem in the lab-to-lab system. What you need to know, this lab-to-lab system is also used for MS, and the distribution of the vial sometimes can be blocked to a problem in the lab-to-lab system and not due to the lab-to-NMR pass. And this gives us an idea. Then we have 5 lab-to-lab, and in a day, pro spectrometer is minimum 25 tube measure, and then they stay here. And in order to find it easily, you can imagine the 2D barcode is not easy to read it. We created a tool, Find My Tube, where the chemist needs just to put his spectrum number. And once he put the spectrum number, he click on search. This tool will tell him your tube is in the rack 4, for example, in position B2. And then just need to go in B2, take the tube, check the barcode is given here, if it is the same, and then you find easily the tube. And it's the same for my case, because sometimes chemists will measure an open access, then he's not able, he need help for the interpretation. I see he measure only a proton and HSQC. That means I need to find the tube in order to measure it on our spectrometer, and to find the tube for me is easier to use this Find My Tube tools. And the last tool that my colleague created, this is a lab-to-lab sample monitoring. This is used for MS and for NMR. The chemist needs just to put his 5-to-1, and then you can see on the right, it was measured in a day by this chemist. When it's written completed, that means the technique is finished, and this one is written in progress. If you click on it, you will see the expected time when the measurement will be finished, LCMS or NMR, and then it will be compared with the actual completion time. This is a simulation according to the different machines that we have on the system, and it gives an idea to the chemist if it will take 1 hour or 2 hours, because if the queue is huge on one machine, here you can see you will not have an answers in 1 hour. That is, don't need to ping us and say, oh, when I will have my measurement. He can he can alone see when will be the expected completion time of his measurement. Now, the difference in NMR, the open access workflow. Chemists can use the standard way. He prepares the tubes, go to the spectrometer, sample jet, he put the tube on the PC in Icon NMR, he fill the things, and this is a manual progress. He needs just to go to the lab, to the NMR lab, and put the experiment. The second way is the lab-to-lab system. He fill the lab-to-lab vials. We ask them to put minimum 220 microliters, because the needle will go in and take 180 microliters in order to be sure that we have less bubble in the tube. Then from the PC, this sender is bound to the PC. He can choose which experiment he wants to measure. This here is important that he choose only one set of experiment, because if you choose 2, you can imagine in one vials we only have enough quantity for 1 tubes, and we decided in this case to block the vial in the buffer, that we are sure that it will not go in one lab to NMR, and the empty vial in this case go to a second one, and you can imagine the tube is empty, so it's not possible to fill a tube and to measure something. Then the robot will work alone. It will arrive in the lab to lab, fill the tube, transfer it in the spectrometer, fill icon NMR in an automatic way. Then here what happened. Once the measurement is finished, data are transferred and ESV will run automatically for all open access measurement. Once the ESV is finished, an automatic email is sent to the chemist with different information that I will show you on the next slide. Here, this is a typical email that the chemist will receive. So on the title, you have NMR open access. The spectrum number is 521. And then you have different links. A data folder links, you can click automatically in. It will arrive on the raw data and different information that you have in this raw data. The ESV report, this one is also saved here in this folder, but it can automatically open it via the emails and other different, and an NMR project too. Then it has in the email also NMR details. If the match factor that Dimitris explained you is higher than 0.8 in our case, it will have a journal lines created automatically from ACD in this email, some purity, and which type of NMR is used, and so on. And more in detail now, just to show you some statistics between the workup and the lab to NMR. One thing you need to know, when it's bound to a lab to NMR, the chemist can, I lose one pictures. Okay. The chemist can also go to the robot and prepare the tube and submit a sample in the lab to lab system. Here I show you through the year that how the chemists use more and more the lab to NMR system. In 23, it was 55%, and today we are more at 80% that the lab to NMR is used. Here you have the distribution of the 5 different lab to NMR. You can see we have a nice distribution through the system. This, just to let you know, this is from this year, and this lab to NMR has a problem for 3 weeks, so it was not used during 3 weeks. Still, he has 40% used from the percentage. Here, I just want to show you the differences between 25 and 26. The big differences that we have this year, the end of 25, this spectrometer here, this 500, was a non-lab to lab. It was a standard sample jet on it, but only 7 samples was measured in a day approximately for this spectrometer. We decided to put it in lab to lab. It was installed end of 25, and you can see now the distribution is more homogeneous. You have approximately 20 samples per lab to lab system. Just this one, the O spectrometer at 13, I will explain you. This is one of the building is very far away and outside we can say from the campus. And the time that to transfer a vial to this spectrometer will be longer to wait a little bit in the buffer, because we have this one sample at a time. The system we calculate, if we win less than 30 minutes to send the sample to another building, it will stay in the buffer and will be measured in the lab to NMR system that we have in this building. That's explain why we have a little bit less for the O spectrometer compared to the other. And now, the different available experiment that we have. Chemists can measure proton, HSQC, COSY, 19F, and phosphor and toxi, so short experiment during the day. The rest, ROSY, HMBC, long experiment, will be measuring during the night. If the queue is empty during the day, every experiment that will last less than 20 minutes will also be measured during the day. Here, I just show you a print screen of the lab-to-lab system. This is all combination that the chemist can choose. Not only one set can be chosen. That's explain why we put different possibility. Proton HSQC 19F, we add the COSY, then we add the ROSY, we add the HMBC, and the complete one. And then some phosphor and special experiment like 100 degrees high temperature. Now, once the chemist send a vial to one of the lab to lab, you can imagine if it is outside of the campus and he arrived in the 88 building, you need 50 minutes to reach the spectrometer and add experiment, because he can say, oh, I ask only one for one proton and an HSQC, but then I need an HMBC now. That's why we decided to switch on the web interface from Icon NMR. they are able to, from their own PC, to reach the ICON NMR web interface for all spectrometer. They will arrive on this web, ICON web, where they will be able to add some experiment. That in this case, we help the chemists to don't move between building and add spectrometer. And with the lab to lab and building to building system, this is important to have. Then now, in order to have nice spectrum, because if you want nice ESV results, the one important thing is to have a nice spectrum. And the peak picking and everything need to be well done. For that, we decided to use the dynamic NMR parameter adaptations. That means in our case, what it will be done. First, the chemist will put the 5-to-1, and it is important that we are able to retrieve the structure from their own ELN. This is done automatically. So the first step is pulling the product mole file from the ELN. Then a proton is measured with the D1 of 10 and a ZG only. From this proton experiment, we will determine a signal to noise in a proton counting experiment in order to have the best signal to noise according to the structure. Then, according to on which spectrometer is measured, from the Excel sheet, the specification of the spectrometer, the probe head will be read. And from this thing, the signal to noise and the spectrometer, we will calculate and change the number of scans from the other 2D or 1D and the NUS experiment. What does it mean? If now I am very concentrated, in this case, the number of scans for the COSY HSQC will be reduced and the NUS will be higher than the other if it is diluted. If it is very diluted, at the end, the standard parameter will be used. We cannot measure very long. As Dimitri explained, if you measure 1 hour carbon, but you are very concentrated, in 20 minutes, you can have the same quality, it's better to adapt it. Here, we use this Thassinia molecule just to show you the results. Now, here you have a fixed default parameter with different concentration for 2 millimolar to 20 millimolar. You can see it was measuring 1.5 hours, but here with the first spectrum, it will be hard to pick automatically. This one also, I think, perhaps at the 6 millimolar, we will be able to do something in ACD and be able to picking automatically. Now, what we decided to do exactly with the same concentration, we adapt the number of scans. That means here we need to measure only 15 minutes, and you see the constant quality of all NMR spectra. This is sure we will not measure 36 hours carbon or 6 hours. We decided to block at 2K for 1 carbon in the automatic way. If more is needed, we can adapt it, but the chemists are not able, they can't change NS of all 2D in our case. Everything is done automatically. And this is done by now. Why we need to adjust this parameter according to the sample? We have sample variety in our case. You can have very small molecule, you can have very big molecule with the ALT and peptide. So we cannot use standard parameter for this high variety of sample. So this is why we adjust the NMR parameter. This is very important if you have script that is in background and if you use ESV. Now, just here, I show you an example of an HSQC. Here, this is a very small molecule for 280, concentration very high, approximately 60 millimolar. With 2 scans, 60% of NUS in 3 minutes. I have this HSQC. And in this case, ACD is able to pick very easily every peak. So you can extract the proton and carbon chemical shift nicely. In this case, we have a very high molecule, more than 1,000 Dalton. The concentration is only 2 millimolar. And in this case, the standard, we will say, will be measured. 12 minutes is the maximum that we will measure on HSQC for open access. 4 scan and no NUS is done. In this case, still, ACD will be able to pick every peaks. And in the first case, carbon will be measured in 6 minutes with 120 scans. And in this case, it will be ignored. Because you need to know in ESV, if you add a carbon spectrum that some carbon is missing, for sure you will have a false negative. That means He will not be able to find some carbon in your carbon spectrum. That means for him, he's not here. So the match factor will decrease a lot. This is why we prefer to ignore a carbon and not to add it in the ASV, or to have something at the end you ended up with only false negative. Now, how ASV is used. I will explain you very fast the way. In our case, we retrieve the structure. It's possible that sometimes 2 molecules can be saved, because in our case, if after the arrow in is ELN, the chemist put more than 1 or 2 structure, all these structure will be tested in our case with the measure spectra. It will only 1 molecule will be tested if the chemist say exactly P1 of this reaction need to be tested. But if you put the ELN only P1 only, or without P1 and without P2, every structure after the arrow will be tested. So here we were able to retrieve 2 structures. NMR was measured. You have your raw data. Then what's happened? ESV will run according to the spectra. It will try to assign these 2 molecules. You will have red, yellow, red, orange, or green dot. If it is green, that means it's exactly in the good chemical shift. If it is yellow, it is a little bit outside of the range. And if it is red or black, that means you're very outside of the range. And then a match factor is calculated. This match factor can be between 0 and 1. And if it is 1, this is 100% correct. If it is 0, it is very bad. Then it compare the calculated and the predicted, and you have the match factors. Then in our case, how things happen, you have the ELN of the chemist. It's important that the chemist put correctly the ELN in the title of the NMR measurement. A proton is measured. With the proton, a signal to noise is calculated. Then we adapt the parameter of the other NMR measurement. 2D and carbon experiment are optimized in order to have the best 2D or 1D that we can have. And we finish in the folder. The chemist will have the raw data, a PDF from the ESV, a SDF file from the ESV. In this SDF file, a lot of information are summarized, like the structure, the match factor, journal lines, and the raw data. Where are the raw data, for example? The mole file that we retrieve will also be here, and the Spectrus file from ACD. What you need to know, in Novartis, we are using, the chemists are able to use only MNOVA. And in this case, it was hard for a chemist to open the PDF and modify it. So we decided to work with MNOVA in order to transfer the ICD assignment to an MNOVA project automatically with MGR. That means once the ESV from ACD is finished, in our case, a second script will run in background and create automatically an MNOVA file for the chemist. Because what you need to know, this ESV, and this is what I explained to the chemist, is a tools for them to win time. It's not a tools that will make the work for them. That means they need to check if the match factor is correct. In this case, it's a very small molecule, no 0.99, not need to do some things. But if it is less than 0.8, I'd always say the chemist, please check. If everything is correct, save it, and you can put it in your ALN. And then if you need to modify something, you can read the diagnostic and see why ACD is not agree with this structure. That would help you to correct the assignment from ACD, and then you can see if your molecule is correct or not correct. Here, what we transfer from ACD, from this SDF file, the assignment is transferred. The molecule is automatically transferred. The match factor, you will have it here, the journal lines, and the diagnostic. And then the chemist can work on it, and they don't only have a PDF where it's hard to change something on it. Now, I will give you some result of ESV. What I did here, I took 1 day measurement from all open access. So in this case, this day it was a lot. It was 207 sample measure on all these open access. I go through all the ESV results and ended up with this result, this distribution. I had 42 true positive. What that mean true positive? I opened the MNOVA file or the Spectrus file in my case because I have an ECD licenses. I open the ACD, the Spectrus file. I check if the assignment is correct. If I am agree, if the molecule, as Dimitri said, we cannot say that the molecule is correct, but we can say that the spectrum is compatible with this structure. And now what is true positive? That means the structure is compatible with the NMR spectra. I have 11 true negatives. That means more than 50% of the reservoir of ASV, we have nothing to do. The rest, no ASV, 3%. What does it mean? In our case, if you are not able to retrieve a structure, no structure, that means no ASV, because I don't have something to verify. I only have 1% of false positive, and this part we would like to decrease a lot, and we reach this part where we have only 1%. In this case, the 1%, it was two sample was false positive. What's happened? Only a proton was measured, and it was in a mixture. That means what did the ACD for this small molecule? He was able to find peaks that are compatible with the structure, and for him it was nice, so he put a high match factor. The second one is the same. You only have a proton, a fluorine, and a COSY, so no HSQC. That means no carbon chemical shift. And in this case, he was able to assign the peak in proton. He was happy. We think that we need to know, in our case, we are using only proton, carbon chemical shift, the multiplicity, the integrations, and the carbon chemical shift from the HSQC. We are not using COSY correlation. This is one option that you can add in your ESV, but in our case, we don't use it. We don't use the Roisy correlation too, and we use the HMBC correlation just to extract the carbon chemical shift for quaternary carbon. And here it was the same. He was able to assign in this sample the proton, and we ended up for 0.78. This is too high for one, but it's only 1%. It's only 2 samples for 207 samples in a day. And then we have this false negative, 33%. Here, what we would like to do is to decrease a little bit this part, but still I prefer to have false negative and to have a very small false positive spot. Now, in this slide, I go through all false negative and try to understand why they ended up in a false negative. You have things, sample like there is a mixture. This is good that it ended up at false negative. I prefer that the mixture is here than in the false positive. You have broad signals, diluted sample will ended up here, or Rotarner. These things, we can't do anything, I think. Will end it up, and I prefer that they ended up in a false negative. Here, this is a part when we need to continue to work with ACD, because we work with ACD a lot in order to reach this result. You have integration issue. If ACD did some error in the integration, that means you have only the half or the double the integration, you will end up in false negative. And here you see 7% of all these 200 was the integration issue. Fluorine coupling. So this I can understand, but we work a lot. We were able to decrease it at 2%. This is nice. But the coupling constant with the fluorine can be huge. And sometimes for ACD, for an automated assignment, for him, it can be 3 different signals and not one triplet, for example, due to the fluorine coupling. If it is in a range that now ACD will give them, he will be able to find it and say, hey, this is a triplet and not 3 singlet. But if it is outside of the range that he is not used to see a big fluorine coupling here, he will end up at false negative. And the last one is the peak picking issue. Sometimes the peak picking can be not done accurately with ACD. We ended up with 1% where we have, we already decreased it a lot, the part that we have to do, to work on it. The rest that in Novartis, the rest we need to work. The NMR measurement issue, what is it? This is why Dimitri tell before, more spectrum you have, better it is. Yes, but it is good if the spectrum that you had a good resolution and the signal are high enough. Now, if I had in my ESV and HSQC, where I had some ATMA issue, that means my correlation will be very weak, I will decrease a lot my match factor. That means having more, yes, but in a good quality. And here what's happened, the NMR issue, what I put in NMR issue, we are using lab to lab, but sometimes it happens that you have a bubble in the middle and the shim will be very bad. You ended up with a bad spectrum quality. So this will arrive, you will have a bad ASV. This is but only 2%. And the last part that we are working on it, this is the 4% chemical shift prediction. We are all working in new molecule, new scaffold. If in your library you don't have a scaffold like this one, ACD will not know the molecule and it will be hard to have a good match factor. That's why it's important to work on your own library and have your own host library. What I am doing here, when I see a new scaffold for the chemist, I will assign it myself with different 2D and 1D. And then when I'm sure, I will save it in a host library, and this host library will be used for the predictions. That means you can train the database and in order to increase your result in ESV. This is, I think, a very important part. Before, this was not 4%, it was higher, and now we were able to decrease it. And each time a chemist work on a new scaffold, I ask them, please let me know. We are measuring once all the measurement, I assign it and I save it. I will not let the chemist save anything in the host library. It's important to save something that you're sure that the assignment is correct. Well, for the part of the result of ESV. Now, what improvement are needed? One thing is very important, this is the quality of the NMR spectra for more accurate assignment. We are still working on it. We have our intern solution in order to increase or decrease the number of scans automatically in order to end up with high quality NMR spectra. What ECD need, we are still working with ECD to avoid the assignment of quaternary carbon based solely on HMBC data when carbon-13 spectra are available. You can see sometimes in a HMBC with ESV, it will put 2-3 carbon on the same chemical shift. This one, I want to avoid it. Then it is important that, and this is a very important part, I think, to improve the automatic integration and peak picking for better data consistency. We are working to enhance the recognition of fluorine coupling constant, and what we ask to ACD, that the identification and the exclusion of residual solvent signals. For a chemist, I will recognize, I think, and all NMR experts will be able to recognize some solvent with the chemical shift. But for the chemist, if it is done automatically and if it is done a good way, that will help the chemist to find this signal is not from my molecule, but a residual from my solution. And voila. And for the conclusion, what we achieve with this workflow, with the lab to NMR, the NMR parameter dynamic, and with ESV, now we have standardized data acquisition and analysis. The result, we win a lot with time. We win time, I think, for the assignment, and we help the chemists to assign themselves simple, I think, NMR. This facilitates exactly the exchange between the chemist and I. They don't need to send me an MNOVA file, or they don't need to send me a PDF to check their own. They just tell me my ELN is this one. I will be able to find myself the MNOVA file and the TextStruct file. This producing and storing data that is readable for machine learning. And then the high throughput is 24/7 is turning and the time saving. Thank you for your attention, and I think the question will be at the end of the meeting.
Yeah. Yes, thanks a lot, Emin. The questions, we will address them at the end. You can all type your questions in the chat box, and we will be answering them later on. So, as I said, thanks, Emin, and the next presenter is Kathleen Farley. So I see your screen is already there, Kathleen, so take it away.
Great, thank you. So for those of you that don't know me, I retired from Pfizer about 1.5 years ago, and this talk is mainly a summary of a couple of the last projects that I worked on there at Pfizer. It's all out in the public domain now. It's been published, so I'm not giving away any state secrets. But I do think there are some learnings. Amin actually did a great job of kind of introducing ASV and kind of leaves me off the hook for talking about some of the details, because I'm really going to focus more on how you can use ASV to impact the chemistry project itself, not just your open access and your routine spectra. So since my retirement, I guess the elephant in the room is that I have formed a consulting company, Solution NMR Analytics. So if you do have something you'd like to show me and have me consult on, I'm just doing this part-time. I am retired, but I still enjoy the intellectual challenge. So please reach out. So for those of you not familiar with the SARS-CoV-2 project, if you work at a pharma company and you didn't have a project going like this during the pandemic, it really stemmed back probably more like 15 years ago, at least at Pfizer, because we had a large project for the SARS-CoV-1 strain that was running around at that time. That strain actually was fairly short-lived and just was a problem for just a few years. So we had a compound that was looking very promising, and we were about to go into the clinic, and essentially it kind of died down, so we put it on the shelf. And that's, I don't want to make it sound like some of the things I'm talking about today are the reason we were so fast. One of the big reasons we were so quick at being able to get something into the clinic was because we had a compound we could pull off the shelf. And it was a great starting point, at least from an IV point of view. The project team leaders decided we really wanted to go with something that was an oral product. And I show some of the biology here for those of you that are unfamiliar with it. And now I'm just going to really jump to the end. Whoop, helps if I go the right way. And I think sometimes it helps for those of you who were not paying attention to this literature or didn't have a project internally to show you what compounds we brought into the clinic. And the first one is this compound here on the left that looks very peptidic. And it's part of Paxlovid, which is actually a marketed product that came out in 2021. So when you look from programs starting at the beginning of the pandemic in 2020 to getting emergency use authorization, it was, 2 years and 10 months and 3 days, somebody actually counted, after the first synthesis. And I'd like to think that NMR played a role, but we were just one part of it. But I think that NMR could play this role in many more projects. And that's why I thought it would be useful to tell the story. When this came out on the market, we knew right away that it was less than desirable to have to co-dose with ritonavir. This is to stop our molecule from being chewed up too quickly in the body. So we knew for a second generation compound, we wanted to get something that was a little more stable. And ritonavir has its own problems in that there's many medications that if you're already on them, you can't take ritonavir. So it meant it limited our population a little bit of who could take Paxlovid. So with the second generation compound, we were interested, and I'm going to talk about how we were able to get rid of this liability. Typically, when we have a big project like this at Pfizer, at least during my tenure, one of the things that we did pretty quickly, probably for the last 10 or 12 years, was to develop an RDC structure. We had a very active X-ray group and cryo-EM that were always, in there and working on a bound conformation. But at the same time, we were very interested in determining the solution conformation. Sometimes because the X-ray and cryo-EM folks were struggling and maybe having a little trouble coming up with it as quickly as the team would have liked. And other times it's because the solution conformation isn't always identical to the bound conformation. So it's useful to know with your lead compound what kind of changes you can make to perhaps make it closer to the bound conformation and have the molecule have to spend less energy to adopt that bound conformation. So typically we would have the computational chemists generate a low energy conformational file, and you can see there's quite a bit of motion in this compound. One of the things that we did pretty quickly for a lot of these compounds is to look at ROE correlations even before we determine the RDC structure. And in this case, it's because we saw very long range, this is kind of a peptidic molecule, long range correlations irradiating the methyls here. We saw correlations, down to 8 or 9 pretty easily. So that was something that we could monitor. Did our molecule have this U-shaped conformation that we soon learned was essential for activity? Because many of the modifications that the chemists suggest, they did not have that modification. And collecting a 1D, ROE like this was a pretty quick way to say active or no active or not active. And the crazy thing was, with a lot of our NMR techniques that I'm going to describe today, we were able to get this data before there was activity testing. So we were faster than the folks doing the activity testing. So we were able to give the team feedback on, where they were going into a new idea and they were really changing the molecule up. Did it retain its activity? Did it retain that key U-shape conformation? And feed that back before they wasted their time making a lot of compounds. So pretty early on, we did look at the RDC solution conformation of this lead compound, 1332. We looked at it in DMSO and determined it essentially had 3 main conformers in DMSO. Conformer 1 here shown in green at 65% is almost identical to the X-ray bound structure. So when 65% of your molecule is very similar to the bound structure, you're going to have a pretty active molecule. For some teams, they weren't so lucky. Maybe the major conformer is not the bound structure, but that gives you ideas of what things you could change to perhaps impact these different conformers. So what type of things did we like to look at? I mentioned, does it have the U-shape conformation? And I also mentioned that our NMR spectral analysis is faster than the activity testing. But the other thing that became pretty clear is that we could look at intermediates that were going through the chromatography cleanup stage, and oftentimes they would generate, because it has multiple stereocenters, maybe 4 isolates, and we could tell the chemist from the intermediate which one to take forward to make the final compound, which one was going to be the active. And that was pretty powerful and literally saved weeks off of each of the new classes that they were making. Because we had stereocenters, we had to worry about epimerization. It didn't happen so much during the chromatography, but it happened sometimes during the chemistry with some of the harsh conditions they needed to use. So chemists were very keen to make sure their compound had not epimerized. Otherwise, it's going to give you false SAR results. You're going to think something is not active when really it's just epimerized, and that's the reason for the lowered activity. And we'll show you here in a minute, at least for this compound, it was very important if the amide bond was syn or anti. And also this amide bond, what was its energy of rotation? It was a little slow in solution, and tended to go one way and had trouble returning back to the original state. So we'll talk about that some more. So this is just a time course now of putting the compound in the crystal state into solution and how does it change over time. When I first looked at this molecule and put it in, I collect a proton at the beginning, collected some 2D spectra, and I periodically collect a proton along the way, and the darn thing was changing. I thought it was degrading or something. But it turns out that it was going from the anti, which it is in the crystal form, to the syn, which it is more in the liquid form. So we could do the time course, and this becomes very important in pharmaceutical development because most project teams will tell you that they like to develop class 1 molecules where you have free rotation, or class 3 where the rotation is so slow it literally takes years for it to rotate. So it's like you have a single compound. And the molecules that are difficult to deal with are these class 2, where it stays between hours and days. So you isolate something and clean it up, and literally while it's sitting around waiting for the next step, in a couple of days it goes back and reequivalates to both molecules. And so this can be a real problem for development. So that's something the team wanted to know, pretty early on, and said, gave me the feedback, Kathleen, can you tell us what's going on here? We really want to stay in either class 1 or class 3 and stay away from this class 2 molecules. The other thing that they were worried about, at least early on, till we got a better handle on what kind of conditions would cause epimerization. And in this case, it's at the 3 position right here. And it's very diagnostic in the proton spectrum. You have something that is equivalent going to inequivalent on the 9, on the 5-membered ring here, and also this quartet going to a DDD. So it's very diagnostic, but initially the chemists weren't sure what was going on. And once we had this identified and we kind of sent around an email to all the chemists on the team and said, this is what you need to look out for, they became our, pretty much then most compounds that had this epimerization problem, weren't even submitted for final testing. So something during the development of this team that we looked at quite a bit was looking at this energy of rotation around this amide bond. And we could do this by collecting Xe spectra on our compounds. And we could do this as part of our routine NMR, data collection. So, earlier in ASV, we talked about, wanting the proton, the HSQC, HMBC, or carbon. But we were adding this experiment on, and it was really for this energy of rotation. So it was an additional thing that we like to look at because we wanted to make sure that we were staying in that class 1, category, that it wasn't taking too long for our molecule to rotate, and really wanted to keep it in the minutes or less category. So along the same time, our library preparation scale had made some big advances, and literally everything the chemists made from intermediates to final products was going through the automated prep process. And they would return product that then went to registration, to compound storage, and activity testing. But this was totally centered around automation and mass spec. NMR at that time, when we first developed this, probably 15 years ago now, couldn't keep up with these quantities. So we kind of had a parallel process. We used flow NMR, but we could only do the compounds that we had enough sample, which wasn't everything. And the chemists hated that. So they would have compounds literally that on initial synthesis, they didn't have enough for NMR, and they would have to resynthesize to get their spectra, to confirm that they had the right thing, or to put it in a paper or a patent, whatever they were doing. So it was really an inefficient process. And we spent quite a bit of time thinking about how we could incorporate NMR into this process. So we came up with the idea of, okay, we have a great process here, but NMR is not part of this process. We don't just want proton NMR, we really want the 2D so that we can do the auto structure verification. I think earlier speakers mentioned that proton alone really isn't enough for great auto structure verification. So we looked at our process, and we had two things that were essentially being thrown away. First of all is a QC plate, and there was also the residual DMSO sample that had been plated out to send to compound testing, but there's always a little bit that the robot can't get out of the bottom of the vial. And we thought, wow, this might be an opportunity here. Is it possible we could take both of those samples, combine them into a sample, dry it down, and make it into an NMR plate? Would we have enough sample to collect our spectra? And we pretty quickly figured out that yes, we could. If we used a 1.7 cryo and we used, a automated system, we could collect the two samples, use a TCAN to make an NMR plate. We did want to dry down the protonated DMSO that the compound library uses and add deuterated DMSO. And then we also, collecting with the sample jet with the 1.7, we could use really tiny samples. So we thought, great, this is probably, I'm saying 2018, 2019 kind of time frame. The problem with this process is, yes, we get great purification now, we've got mass spec, and we're getting great NMR. The problem is we're getting tons of NMR, tons of spectra. So what do? We're doing high throughput. I've got more spectra than I can shake a stick at. I don't have enough NMR people to sit and look at them. Even drafting all the chemists that were on this team, nobody wants to look at plates and plates, every week of samples just to give you the thumbs up that it's the correct sample. So we started working pretty closely with ACD and adding the ASV. We had tested it previously in our open access instruments, so we were pretty familiar with it. But we wanted to bring it now to this high throughput mode for a project team, really looking at maybe intermediates, final products, everything that team was making. And we wanted to do it fast. So initially when we looked at it, and Demetrius probably remembers a lot of emails back about this time, and some samples worked great, but I think if you look down the center here, you can see that some of these samples were not as dry as you might have hoped. And it really, our problem was we knew we needed to reduce the water content. So we were really hoping that working with the robot would do it. And we initially added a nitrogen flush because it is in an open environment. And that improved it somewhat. It took it from this, up here, water content by the end of the plate was going up. But really, until we built a customized enclosure and put the robot that was preparing the plates inside that enclosure, that's when we really got, these nice spectra up above with nice tight water like you might see on a hand-prepared sample. And that's when our ASV numbers really started working well for us. So now we had, reports being generated, match factors, and that's fantastic because now it allowed me, instead of, verifying structures or the chemists, now I could spend my time looking at data and thinking about how is this going to impact the project. So I was able to look at chemical shifts that I knew meant it was in a U shape or ROEs. Chemical shifts that I knew meant we had the right epimer. Was there a change in conformation? Was it out of its U shape? Was there something new coming in? A lot of times we would have resonances shifted far downfield with a different conformation that was less than optimal. Did we have the syn or the anti-amide bond? And what was our energy of rotation? Were we staying in that class 1 compound? So I'll jump to the answer. This is our first generation compound that is in Paxlovid. And you can see here our torsion rotation or our energy of rotation is around 20 kilocalories per mole. And in the second generation compound, we were able to reduce this to 18. But the big number you can see here differently is the torsion rotation. So now instead of minutes, we're down in the seconds of this thing rotating. And we actually think that it's going quickly enough now that in your body, it's not being digested as quickly and broken down. So that's a big plus for this second generation compound that is now in phase 3 and on fast track from the FDA. So this last slide just kind of summarizes now our first generation compound that is marketed as Paxlovid and our second generation compound that now we do not have to dose with ritonavir. It does have a lower RRCK, but the human bioavailability was good, and we think that's mostly because of this rotation now around that amide bond. I won't go into a lot of details of the clinical trials. I've kind of been off the team, but you can look on Pfizer's web page if you're interested. They keep a pretty updated list of where compounds are in clinical trials. And that's how I was able to confirm that this is still in, finishing up phase 3 clinical trials, and it's been fast tracked by the FDA because a lot of that happened after I had retired. So I don't want to make it sound like I was doing all this myself. I definitely had a lot of help. Martin came in somewhere in the middle of that project and was really instrumental in helping us get the ASV that we had been using on open access. Tim and Reto really helped during the whole pandemic when only people working on key teams were allowed to come in to work each day. So a lot of this work had to be done by essentially a pretty skeleton crew, at least initially, until everybody was allowed back on site. We had a huge chemistry team, huge chromatography team. Justin Bellinger really kind of owned that robot and getting it working with low water and preparing those plates for us. It's pretty nice when you have a team that just sends a carrier a couple of times a week with plates for your team. And we just had to actually, place them on the sample jet and run the samples. So we could spend our time then evaluating data and reporting back to the team. It's probably one of my most successful examples of being integrated on a chemistry team and really making an impact. And I think it shows in, how quickly some of these molecules were developed and, made it into the clinic. So I guess the last thing I want to leave you with is just to remind you that I no longer work for Pfizer, so they haven't approved anything that I said, but it all came out of our publications. So it's all in the public domain. But if you'd like to talk about some of this or you think it might be useful for your team or your company, please do reach out. I still, have a lot of fun solving NMR problems. And I plan on being probably at SMASH later this year. And I'm still involved on the poster committee there. And so I like, keeping up, seeing what everybody's doing. And with that, I'll be happy to take any questions at the end.
Okay, thanks a lot, Kathleen, for an excellent presentation. So yes, as we discussed, please type your questions to the chat box and we will address them all in the end. And without further ado, I think we can proceed to the next presenter, who is Richard Lewis from AstraZeneca. Richard, it's all yours.
Hi, thank you. Thanks very much for the opportunity to speak. Thanks to the earlier presenters who've done a good introduction for me. So I'm going to talk about using the ASV tools, but in a slightly different way to what's been described previously, and I'll explain why that is. So what I want to say is why is ASV still relevant? You probably read in the literature all these AI tools that claim to do amazing things. Why do we still need ASV? I'm going to be talking about using the ASV approach, but not to look at individual compounds, but to compare candidate compounds and why that works better than a traditional ASV approach. And then I'm going to be talking about expanding the NMR, the ASV approach beyond NMR data. So Demetrius already mentioned mass spec. A few people have mentioned mass spec and they weren't kicked off the meeting. So I hope if I talk about infrared a little bit, that I won't be kicked out of Ivan either. So, and I think what we're trying to do, we have unknown structure here, a monster that we're trying to tame. So thank you to my collaborator, Jonathan Goodman and ChatGPT for coming up with this picture. The journal wasn't so keen on it, so but I still think it's a nice picture. So what do we want? So what I'd like a system that generates the correct structure from the data. So I mean that would be fantastic, wouldn't it? If we could just, if we had a system where we could just give it an experimental proton spectrum and a HSQC spectrum and molecular formula, and out would come the correct structure, and that would be right 99 or 100% of the time. I say that those systems don't exist, despite the hype you might see. Maybe they will one day. I think they're still quite a few years away before we can get something that will come up with a reliable structure. So in the meantime, while we're waiting for such a system, then what we want is a system that will compare one or more synthetic structures with analytical data and decide whether it's correct. So the context is working in synthetic chemistry, where we're making maybe hundreds of compounds a week. There's increasing automation, like the libraries that Kathleen was talking about, where we really don't have a time to look at the data, and we want a way to automate that. I'm assuming that we're using mass spectrometry. Okay, so we already screen that the molecular formula is correct. So if we have a reaction, we're expecting a product, we get a product of the right molecular weight. So what we want to do is distinguish between different possible regioisomers that might have come out. And they are, by definition, very similar to each other. So actually distinguishing between them is not at all easy to do. And then we also want to do this high throughput. So there's limited analytical data that we can collect. So really we want to ask the question, what data is the most valuable? What gives the most input? And then ideally, it would be good to know when the system doesn't know. In other words, if we could have a stream where you know, yes, the compound is correct within a high level of confidence, and another stream where you're uncertain in this case, in which case we could send that to collect more data or to human interpretation. So just as a little background, why would we do ASV? So if you think, ideally we'd like a system that will solve any problem, that will come up with a structure, we just give it data. So think of that a bit like a a chemist who's found an old reaction at the back of the fume cupboard and isolated something from it, but they don't know what it is, or alternatively, a natural product that's been isolated where we want to determine the structure. Okay, so that's one type of very valid problem, but we kind of know from our experience it's not going to be an easy problem to solve. We're going to need to collect loads of data, and we might not even actually be able to give a definitive structure at the end. On the other hand, another situation where we have a chemist who's done a defined reaction and they've got several products out of it, and they ask you which of these regioisomers or stereoisomers is which. So as an NMR spectroscopist, we'd probably be quite happy, tackling that. We say, oh, that should be pretty straightforward. I can probably give you an answer pretty quickly and on a limited set of data. So what I want to say is, don't think that the ASV is inferior to other approaches. Just think of it as a different method to reach the same goal. And the goal is to find a structure that's consistent with the data. Okay, so as an introduction, so I want to say that when you're thinking about ASV, you need to think about not only the compounds that you want to pass together, but you also think about what you want to distinguish them against. So what do you want to fail? And the problem really, if you're thinking about reaction products that we've screened by mass spec, so they're regioisomers and they're probably fairly big molecules, is that they all look very similar to each other. So the differences between them are pretty small. So what we wanted to do is to kind of evaluate actually how well does ASV work distinguishing tiny differences like that. And we had this set of let me get the laser pointer. Yeah, structures here. So these were where we made small changes, isomeric changes. All have matched molecular weights. They're all just a change in usually just one position in the molecule. So things that are representative of real situations you might come across, but for which there isn't necessarily an easy solution. So just to give you an idea, roughly about half of these would be kind of classified easy. So for a chemist or a spectroscopist, you think, oh, I just need to run a proton spectrum or a COSY or something. Some of them were moderate, so they might need an NOE, and then about 25% are actually quite complicated. So you might need a full structure elucidation to do that. So how well does the ASV work in the traditional sense? So in other words, choosing a threshold where you can determine a yes or no answer. And the answer is, I'm afraid, not very well. And you can plot the data on the on a ROC curve, a receiver operating characteristic curve. And here you're plotting the false positive rate against the true positive rate as a function of the threshold that you've chosen. And where we want to be is up here in this top corner, which is like a true positive rate of 100% and a false positive rate of 0. And the closer you get to that, the better your system is working. So we're getting some discrimination. I should say a random process goes along the diagonal. So for sure we're getting some discrimination, but it's not really good enough to have a viable system, to be honest. But there's some good news coming. So and that is to look at the differences in scores between the candidate compounds rather than the absolute scores itself. So why might that work? Well, I mean, if you think back to Emin's talk, the reasons for things being false negatives, things like poor peak picking, rotamers and things like that. If you're actually comparing similar compounds, you would expect a lot of those to actually cancel out, because they're the same experimental data set for both candidate compounds. So the difference in scores should be a lot better. So how does that work in practice? So we have candidate compound scores. So we have a number of candidate molecules. We calculate the difference in scores between the candidates, and then we decide whether that the difference in scores is significant. So the hypothesis is that the higher scoring compound is correct, but then it needs to be higher scoring by a certain margin. So if it's not significant, then the problem is unsolved. But that's kind of good that we know that, because then we know that we need more data. We can't distinguish between the two compounds. And then if it is significant, then it's solved. And either we get the answer right, true positive, or we get the answer wrong, a false positive. And we can modify the ROC curve to something we call the structure classification characteristic, where we're plotting the proportion of compounds that are solved or that are unsolved against the true positive rate. And again, we want to be up here in the top left-hand corner where everything is solved, nothing is unsolved, and everything is solved correctly. And so with the NMR data, if you remember where we were in the previous, we were maybe a third towards the goal. If we think where we want to be up here, we're a lot closer to the goal by following this approach. So here, for example, if our criterion is that we want to be right 95% of the time using HSQC, we can get there, and we can choose the threshold to get us there, and then we have about 35% of the cases which would need manual interpretation. So that's good, but it's not good enough. How can we get it a little bit better? So this is where I'm going to talk about some other data, non-NMR data. So just for information, we could run a carbon, and that does get a little bit better, but not masses better than the HSQC, actually. So the HSQC seems to be quite a good sweet spot at a spectrum type to use. Okay, so this comes on to thinking about using infrared data. And this is a collaboration with the Goodman Group in Cambridge, PhD student Benji Rowlands, and an earlier master's student, Lena. And the idea is actually collecting an experimental infrared spectrum and comparing it to a calculated infrared spectrum using a matching algorithm. And this work we've now published late last year, so you can look it up to get some more details. So this is just an example of it working on two of those isomer examples, and you can see there's a better overlap, which gets a better score with the correct answer compared to the incorrect answer. So we wanted to see how general that was. So we applied it to the same compounds that I showed you before, and plotted it on the same scales I did before. So this is the same curve that I showed you earlier with the proton and the HSQC. So how well does infrared do on that? It actually does surprisingly well. If you're not familiar with infrared, it's actually pretty good at distinguishing between isomers. So it does better than proton NMR, but not as good as HSQC. But what we'd really want to know is what happens if you combine the data. So I just show you those quickly. So we've got proton, we've got the infrared, and here we've got the combination of proton and infrared. So both for ACD derived proton scores, but also for DP4. So that's another measure of a match of a spectrum against a proton NMR spectrum against calculated spectrum from the Goodman group. So we see very similar trends that actually if you combine proton and infrared, you get something better than either of those on its own. So what about the HSQC then? So then it works even better, actually. So it looks like a combination of HSQC and infrared might be a very nice combination of analytical data to use. And we're getting very close to being able to distinguish 95% of all isomer pairs with almost none remaining unsolved. Sorry, at a 95% confidence level where we're right 95% of the time. So I just want to say very briefly about how we're implementing some of these ideas at AstraZeneca. So we have what we call the ASV difference engine, and it's comparing structures in an automated way. So you may wonder, well, where do these different candidate structures come from? So the answer is from reaction prediction software. So our IT team or our AI teams developed reaction prediction software that will predict products from a given reaction. So putting that all together, what is actually happening? So we are collecting proton COSY and HSQC spectra automatically. These then go into the analytical database. So they're archived automatically. So at that time, a parallel process starts. So the ELN reaction, so the ELN reference, the chemist's lab book reference is embedded in the data. So that's extracted. That is sent off to the CASP, the reaction prediction software, which predicts alternative products that might be made. So these are matched for molecular weight because we're assuming that all of these have been pre-tested by mass spec and they pass those criterion. And then the expected products and the one that the chemist wanted and the alternative products are scored against each other. And the chemist is notified when we believe there's an alternative product that actually fits the data better than them. So this is something we implemented towards the end of last year. I should say it's only working with the NMR data at the moment. We have work in progress to add the infrared data as well. So just finally, I want to show you like kind of a real case where infrared helps. So I've said here, infrared helps when NMR fails. So here's a real reaction that gives 3 different products, fraction 1, fraction 2, fraction 3. There are 3 potential products in the reaction, all attached to the different nitrogen. So the question is which of them is which? So I say when NMR fails, what I mean, of course, you can work out these products by NMR. What I'm talking about is how can you do it using the least amount of data in the most efficient way using the least amount of compounds. So that's when I think infrared might be a help. So here are the scores. If we score based on the HSQC spectrum, you see all of these, and if you look at them in a row wise. So for example, fraction 1, is it product 1, product 2, product 3? Similarly for fraction 3, is it product 1, product 2, product 3? So all of these actually would pass a traditional ASV because all of them would score high, but only one of them is correct in each time. And even using the difference, actually, we aren't very certain which is the correct one. We can probably exclude this one. We're probably pretty clear that product 3 isn't fraction 2 because of the low score, but the others are very difficult to distinguish. So if we collect the infrared spectra and do the analysis I talked about, the results become clearer. So we can say that fraction 1 for sure is this one. Fraction 2, we're not really sure if it's product 1 or product 2. And again, fraction 3, we can say pretty clearly on the scores is the third product. And that is, in fact, the correct answer there down the diagonal. Okay, so I hope you've forgiven me for going into non-NMR for a little while. Hopefully we consider ourselves analytical chemists. We love NMR, but we also want to solve the problem. So the question is, what's the best technique to solve the problem? So in summary, I really strongly believe in the ASV approach. I think it's a practical solution for a practical problem. I think comparing candidates is much better than thinking about a single candidate structure. I think infrared is a very promising analytical technique to combine with NMR. I think there's a very good scientific reason for understanding why it's complementary, because NMR is giving information really at the atom level, whereas infrared's giving information about bonds and multiple bonds and how they all kind of interact together. Maybe you want to talk about AI in the discussion. I don't know. I think I mean AI is very interesting development. I'm sure it's going to have a part to play in the future. I'm not quite sure what the timescale is going to be, but definitely an area to watch. And I think with all these developments, the best, if you're building an ASV system, I think the best thing is to have a modular approach. In other words, have different modules that do different things. Maybe you have ACD or Mestranova or DP4 or something that analyzes the NMR data. Maybe you have another module that analyzes infrared data. Maybe you have another module that is looking at mass spec fragmentation or retention time or something like that. Okay, so I think that is it. Just as previous speakers have said, this is absolutely not not just me. This has involved a lot of people working together, and I hope I have managed to acknowledge all of them on this slide here. So thank you.
Okay, thanks, Richard, for this nice presentation. Even though you spoke about IR, we'll leave it for the moment. We have some questions that are appearing. However, before going into them, I would just like to discuss with you some of the questions that I get frequently from people when we first show them an ASV system. So the question that, actually the comment that I hear most frequently is that, I don't want to use an ASV system because it's going to make my chemists lazy and they will just take the result from the ASV and submit it for registration without checking. What would you say to that?
This is a risk, yes. This is a risk, but you have to train your chemists. You have to explain them this is a tools, and they have to use it as a tools and not believe in 100% of what they receive. And this is why I'm giving some NMR training to the chemists. At the same time, I explain them how to use ESV, because there is a way to use ESV. It's not I receive a PDF, I see the match factor, and I continue my chemistry. And this is the other way. I have this year very interesting things that a chemist was receiving a molecule. He thinks, okay, it's the correct. He measures the NMR. Compare at what he measured 2 years ago, the spectrum was not the same. And what he did 2 years ago was correct too. 10 years ago, a patent was written. It compares the chemical shift of the proton. It was the same. He continued the chemistry. I just asked, he received another one for another company. He said, hey, Mine, the spectrum is not the same. I think it's a wrong isomer. What is it? I said, no, this one is correct. I did the NMR, I assign it, and I check what happened 2 years ago. 2 years ago, ESV was running. It was a small molecule, but it was not used to have a look on the PDF. And the match factor was low. I tell him, here you have a hint. The match factor was not good. So you only measure a proton and HSQC. You are not able with human eyes to be sure that this is the wrong one. You need an HMBC and ROSI to prove it. But you have a hint already here. So there is a way to use it. It can be a false negative, but you have already a hint of perhaps I need to measure more or to ask an expert to see if my molecule is correct. So you don't have to take it at 100% is wrong or 100% is positive, but that will drive you in which direction you will go. I think the chemists will not be lazy, but they need to change the way to work.
Okay, and I mean, I can say that during that discussion in one of the follow-up meetings, we brought in some of the chemists to see what they said about this. And the group leader said, who told you? He said that we are going to submit something for registration without checking it. We will check it. So, yeah, sometimes, we may have some misconceptions about the chemists, but usually, they are not trying to, cut corners and fool everybody. They do have some, consciousness on what they are doing.
Yeah.
Of course, yeah, what you said is correct. Okay.
Just to comment, we were worried about that as well, that some chemists might do that. And ACD was very nice to put a disclaimer at the top, right next to the match factor, saying that, these results still need to be verified, that the coupling constants, all the peaks are actually there, just to remind the chemists that it's, you shouldn't paste it into your notebook without thinking about it.
Yeah.
I'd say in
if
our,
I,
yeah.
sorry,
In-
if I may,
in our- sorry,
if I
Chris.
may, sorry, Richard. Yeah, go ahead.
Okay, no, I'd say in our system, actually, we tell the chemist not to pay particular attention to an individual match factor. The important thing is the difference. If you find a compound that actually scores a higher match factor than your candidate, then you need to consider it seriously. But yeah, I mean, absolutely, I agree. The final decision has to stay with the chemist at the moment. I think you can envisage a time in the near future when you could have automatic registration, but that's not quite here yet. So,
Yeah.
If I may add an interesting anecdotal comment here is, I hear from Emin and Richard about false negatives, and Richard actually put a slide where artificial intelligence and all that. I think false negative is not bad as long as you recognize it, because one of my professor who is no more anymore, George Ola, he used to say a negative result is probably better because you learn from it. A positive result is something that you go away saying that I know what I'm doing. Majority of the time, a lot of time in science, we just say, we learn from what we think it should work and it didn't work, and we learn from that. And that's the way to advance. I think that the ASV, which I was trying to work 25 years ago, has come a long, long way. I'm hoping these kind of collaborative research continue, and one day we will reach a point where in Richard's graph, we will be zero false negative false positives or 100% true positives. That's just the way it goes. Yeah.
Okay. Then this, Chris, would bring us nicely to another question that I hear frequently. And this is that if this ASV system works as you say, or as you predict that it will work, then my company will not need me anymore. So, I don't want to get it.
I think
what do you have to say on this?
I understand, Dimitris, but that is true not just for NMR. That is true with every labor group, right? when we go advances, the labor groups flavor changes, the structure changes.
Yeah.
And that's probably what we all need to do as well.
Yeah.
We don't have to live with NMR all the time, right? We can bring in we can learn something, and we can do something that we never thought of before. So I am not worried about people losing jobs because of automated systems. But that's
Now you have to learn to work with automatic systems.
Exactly.
And the spectrometer are still here, so they still need human person to take care of the spectrometer. And as I was working in Novartis for 20 years now, and at the beginning I was receiving 30, 40 samples a day, but it was so easy for them. And I think now we receive only challenging molecule, and this is perhaps better. We have time to work on challenging NMR interpretation, and not only verification get done by a chemist or by an automatic system. And this we find time to work on more challenging, different way, different molecule, and we're still receiving requests. That means ESV, ACD still is not able to solve this difficult and challenging molecule. And we will still have work, I think. And naturally, we are less and less in a group, so you need to find a way to reduce this, we can say, support work. So I will not say easy work, because it's not, depending on who is doing the work, it can be difficult and not easy. But there is things that you can automatize, and why we don't live with the world of today is AI, automatic system, winning time. We are less and less in all jobs, I think, as you said, in all company and all different departments, we are less and less. So we need to find a way to win time. We are not a robot too. So if we are able to automatize something, I think it's a good thing.
It increases our throughput.
Yeah,
really.
Exactly.
Yeah.
I mean, that's the way I see it as well, that the, that I can't envisage a time when automation or AI or ASV is going to solve everything 100% perfectly. So it's much more about doing the easy, boring things and leaving us for the more challenging, interesting work.
Yeah, and this is the other question that I'm getting, that that's like the opposite is, if ASV can never achieve 100% accuracy, then it's not good for us. Okay, well, this was answered, already multiple times, that even if it's 50% good, this means 50% workload for you. So
you work 50% time.
Yeah, 50% time.
Yes, this depends how you see the glass. If it's empty, 50% empty or 50% filled. This is, I will win 50%. This is not nothing. Okay, winning 100%, this is not possible. And hopefully I will say, because that means NMR is not so easy. It's not an easy technique. It's learning by doing. So you need to do in order to learn to assign it very well. And this is, and you win time, and perhaps we are able now to work some more interesting things that before we were late. I will do it later. But now I have time to work on this part, perhaps more than 10 years ago.
I'd say there's another benefit of the systems, and that is, even if the match factor isn't 100% reliable, what it's done is done a very good job at assigning and peak picking the spectrum, and that might not be 100% perfect, but I would say it's a lot closer to being a good result than the chemist spending half an hour doing that work. So
yeah, so this brings another comment that I've heard, that this is not from the industry, it's from academia. And they say, I don't want to use the ASV because I want my students to learn how to interpret NMR spectra themselves. So what would we say to this?
I will say, yes, it's true, but you still learn with the ASV how to interpret it. Because it will give you an idea. You look for the results and you say, the methoxy group is coming there. It's a little bit more shielded if he has an ester. You're still learning. It depends how, if this is true. If you take the PDF and save it, it's finished, you will learn nothing. But if you open it, try to modify it, try to understand the assignment of ECD, you will learn. I'm still learning, for example, when I am using ESV in order to win time when I receive a request. ESV will run in Novartis for all NMR measurement. And I will append the spectrus file from ESV. If I don't like it, I will delete the result and start from scratch. But if I like it, I will just modify the part that I think is not logic, and I will win time. And I'm learning like this because, I was waiting this ping here, but it's not here. Is it true? And I will learn like this. It depends how you learn.
Yeah, so I mean, the thing is that they shouldn't be seeing ASV as something competitive or something that's going to spoil the students. They should see it as a second pair of eyes looking over the data. And it can be that the student or the advisor, they do an interpretation and they miss something, which would have been picked by an ASV system. They would go ahead and publish the results with this wrong result, with the wrong interpretation, and then they will have to retract the paper. So it's a second pair of eyes, a reassurance that what you are doing is correct. Okay. So we've had some questions in the chat that appeared. I don't know. I mean, you answered some of them already in the chat, but I don't know
it was about lab to lab. That is why I sent.
Yes, that was from Stefan Zek. I don't know, Stefan, if you are still around. Do you want to unmute yourself and ask this question so that we can discuss it? Is Stefan still around?
I don't see him in the
list right now. I don't see him in the list.
Yeah, he was asking the time, but he was asking the time from the lab to NMR workflow. He asked how many time it takes from the submission to receive the emails. Last year, when we have 4 lab to lab, it was approximately a mean average time 50 minutes. This time can be shorter, can be longer, depend on if it is a calm week, quiet week, or a very busy week, or even in this week we have 1 spectrometer in maintenance. You can imagine the time will increase. Now it was 50 minutes last year. Now with the 5th system, we are more at 35 minutes. That means between the submissions and the received email in a day. And in the day, proton, HSQC, and COSI maximum can be measured. That means if it is only a proton, it can be faster. If you need the free technique, it will be a little bit longer. But the mean time is now 35-40 minutes between the submissions and the reception of the emails.
Okay. Then there is another question. Yeah, it's about lab to NMR again. How do you avoid that there are no bubbles in the 3 millimeter tube? Any comment there?
I will not say we don't have bubbles. We have bubbles. But we have less and less now. The needle, what you need to know when you are filling it manually, this is clear with the MSO, is up because it's viscous. It will stay at the top of the tube. But in the lab-to-lab system, the needle go until the bottom of the tubes, and it go up slowly, and it fill the tube like this. That means we have perhaps 1 sample in a day with a bubble. We still have them, but not so much. It's easier, I think, for the robot to fill it compared to your human with the tips and with the pipette.
Okay. And I think one last question that's probably coming again from what I've been hearing. There are people who were saying that, ASV will never work for me because the compounds that we have, they have probably new scaffolds, or they have atoms close to charged nitrogens, or we have many heteroatoms, or we have rotamers, or whatever. So what would you say to this? I mean, you already kind of answered this in your presentation, saying that, you make your training database. But yeah.
For the rotamer, we were speaking with Marcus. If, you can choose in your system, in your workflow, if your NMR measurement will go through the ASV. And one of the questions that we have in the team, it was, if we notice this is rotamer, perhaps we will stop it and not send it to ASV. Then I told Marcus, yes, but no. Because, also with the rotamer, you will have a mixture of 30-70% or 50-50. Still, ASV will help because he will start to assign it. It will have a bad match factor, but it will give an idea to the chemist first. This is a rotamer. Second, some peak will be assigned, and it can give an idea of the chemist if he has the correct or not correct spectrum. That's why, for the moment, we still run an ESV for rotamers, and I think we will keep it. This is true. You will not have a good match factor because everything is doubled. You have mixtures, but that helps the chemist to assign it, because when you try to assign a mixture of rotamer, is not so easy. I think it will help not to have a red, green light. Oh, it's correct, you can continue. But it will help the chemist to be faster in the assignment of rotamer mixtures.
Okay. And I think there are no more questions around. So
Thank you.
maybe we can close this. We pass it over to Chris, is it? Or to
Yes,
Dave, or
yes.
who is ringing the gavel thing?
Yes, thank you. I want to thank all the presenters. A very exciting discussion. I'm sure one day Dimitris will give me a package that will work 100%. With that, I think we'll close this discussion. Just want to remind you, if any of you are still here, have ideas of what topics or speakers or yourself for Ivan workshops, please reach out to us. We will schedule you in our events. Thank you very much. Thank you, Dimitris, Emin, Kathleen, and Richard.
Thanks a lot. Have a nice evening. Bye-bye.
Bye-bye.
Thanks.
Thank you.